Hi, this is Sean Sullivan from Sullivan and Bird's Healthcare Technology team, and I'm here with my health policy colleague, Brian Lee, to discuss CMS's telehealth updates and the proposed 2022 physician fee schedule. Brian, what are some of the biggest changes that we can expect for telehealth policy in 2022?
Thanks, Sean. I think there are two important proposed changes regarding how mental health services in particular are being delivered remotely. These are largely connected to statutory requirements that were enacted through the Consolidated Appropriations Act of 2021, which was enacted at the end of 2020. These changes create new flexibilities, but also in some ways restrict how Medicare beneficiaries are able to get services via telehealth.
Brian, I think you're right, and it's important to note that some of these changes were required by statute. But what can we expect for telemental health in 2022?
Yeah, so the Consolidated Appropriations Act and the new physician fee schedule proposed rule, which, if finalized, will eliminate the rural geographic and originating site location requirements, which those have largely been waived during the current COVID-19 public health emergency, but only for the limited instances of diagnosis, evaluation, and treatment of mental health disorders when using telehealth. So if relying on this change, or in other words, if you're providing telemental health services to a patient in a non-rural location or in an area that's not an eligible originating site, like a hospital or a physician office, the patient must have had an in-person non-telehealth visit with that practitioner within the last 6 months.
Yes, I've heard a lot of providers that use telehealth have said that this change feels like one big step forward, but also a step back for telehealth with the new in-person visit requirement every 6 months.
I would completely agree. I think there's certainly, you can see advancement, but you can also see sort of the drawback. It is helpful to see that some of these restrictive originating site and rural geographic location limitations start to get chipped away at. And keep in mind that the 6-month requirement, it's only for mental health services that do not otherwise meet the existing originating and geographic location requirements for telehealth.
Yes, and note too that because of the pandemic, the originating site and geographic location limitations have been waived, as you noted, during the COVID-19 public health emergency. So there's unlikely to be a significant impact, at least immediately.
Right, and I think this is a very large focus of a lot of healthcare providers and stakeholders, and even among members of Congress. And we could see in future legislation additional changes to telehealth requirements before the end of the public health emergency.
Great point, Brian. And you said there were two things. What is the other important change that you mentioned?
Yeah, the other is a proposal to allow payment for audio-only telehealth services, but for the narrow instance when it is for mental health disorders, consistent with the changes that we were talking about before for telemental health services. For example, in that instance, payment would be provided for the audio-only telehealth service only after an in-person visit within 6 months prior to that service.
Yes, and that's a key point, and I think again illustrates this slow sort of chipping away of the narrow restrictions and limitations on telehealth services. So feel free to reach out to Brian or me or anyone on our healthcare team to discuss this or any of the other telehealth proposals in the 2022 physician fee schedule proposed rule. Thanks for joining us.